as I thought about this address, the connecting the dots of the emotion that people bring to public policy, the research that we do, and the impact that we hope to have. I hope to tie those dots together, as well as give some recommendations to the field for how we might move forward. So I don't know if many of you have seen this. I'm guessing many of you have. This is from Ron Haskins, past president of APPAM. He's shown it, I think, 437 times over 20 years. And it's Ron's estimate of the factors that influence policy decisions. And down at the bottom, you'll see this little red sliver. That's the effect of research and evidence on congressional policymaking. We are the 1%. And I hate being the 1%. So what I'd like to talk about is how we might do better. All of these other things certainly affect policy. Lobbying groups, constituents, the budget certainly has a big effect on policy. Maybe we should be lucky that we even hit the pie chart. But what I'd like to argue is if we pay more attention to the emotion that's driving all of those factors, then we might ourselves be able to have more of an impact. So how does that make you feel? It could make you sympathetic. It could make you angry. It could make you want to run. But what I'd like to argue is we need to be getting closer. We need to be approaching this type of, not that type of emotion, but emotion in general. As David noted, most of my work has been with children. I thought that would be the type of emotion I should at least kick off with. But I'd like to tell another story. I'm not the first person to think of this, of course, and I've always liked this quote from William Douglas: 90% of any decision is emotional. The rational part of us supplies the reasons for supporting our predilections. So, again, this isn't a new concept, but I'd like to challenge all of us to think about how, if this is the way policy is made, how do we deal with this? How do we think about it within our own work? So we have, I think, prided ourselves, and again, Russ talked a lot about in education how we have become better scientists. We've improved methods. We've done more to address the issues of causation in our work. But in the end, I think the question is whether some of the distance that we might create in doing that has actually counted against us having the kind of impact that we might have. So I'd like to argue that we could do better keeping our scientific rigor, but possibly getting closer and responding to the emotional drivers behind policy. So to do that, I'd like to tell a story. It's a story from my own career, and it's a story of failure. So I was involved in many projects, and I think many of them failed if you go back to the question of did they have the impact that I hoped. So I was a loser. I failed, but I think I could do better, and I think we as a field can probably do better, and I hope that my story resonates with some of you, even though it may be about a particular field. So my story is going to be about child welfare, which David noted was where a good chunk of my work during my career has been. And I think it's hard to argue that this is in a very emotional area. It involves the maltreatment of children. It involves the taking of children from families by the state to place them in foster care. So there's a lot of emotion around that. But I would argue that really, if we stop and think about it, all of the fields that we work on in APPAM have some similar emotion behind them. In healthcare, there's the question of, can I keep my doctor? Very personal, very emotional question. In education, people worry whether charter schools will undermine the public school that they have their children in. Again, a very emotional question. In crime, will my neighborhood be safe? Will the people who are involved in that system be treated fairly? And then there's teen pregnancy prevention. Becca and I will talk with you about that later if you want, but I'm going to leave that one. But trust us, a lot of emotion in that area as well. So what I'd like to do is tell a story and again help you think about how, even though you may not have participated in this field, perhaps some similar things were at play. The story, as you might have guessed, is the story about a good evaluation that missed its mark. It was rigorously designed, it was carefully implemented, but in the end it didn't have the impact that I would have hoped that it would have had. And why? I think back on it, I think it's because we failed to connect to the history of the issue, the emotion behind the issue, and the fact that we didn't get close enough to those involved in policy decision and practice on the ground. So for context, I'd like to go back a few years. I wasn't in the field when Moses was pulled from the bulrushes, but the point is that child welfare has a pretty long history. It goes way back. Children have been adopted and removed from their parents, or people have been concerned about the treatment of children for millennia. And the emotions behind that, I think, have been there from the beginning. The modern child welfare system probably could be traced back to the progressive era in the US, and the emotional tensions that were set up around that era are still what drives what's happening in child welfare. There are two powerful emotional storylines, and sadly, they're a bit at odds with one another. So on the one side, which these pictures represent, is the desire to save children from the risk of potential harm. It's simply human to want to help a child who's at risk. And in the progressive era, this was epitomized by several interventions. One was friendly visitors, as they were called, who investigated the conditions of homes of children and sometimes resulted in the removal of those children from those homes. There were also things like the orphan trains that took orphans, separated them from their siblings, and sent them to new families. So there's always been a desire by well-meaning people to intervene in the lives of children and families and try to save children from what are difficult circumstances. And this is totally with us today. A week doesn't go by when a child welfare system is not called to task for making a horrible mistake in its dealing with children. Agencies are called to task for failing to remove a child when there was some signal that there was risk. They're called to task for returning children who are subsequently harmed. So the desire to rescue children from these situations is a very strong emotional pull that's with us always. But there's also another side and another emotional pull. And that's that children shouldn't be separated from their families, that children need their families. Sadly, people of color, new immigrants, those on the lower edges of the economic spectrum, have always been the most at risk of losing children into foster care. And the state's intervention to do that is probably, I would argue, at least number 2 on the list of the most powerful things the state can do to an individual. So people get very emotional about that, and they should. They get as emotional as people do about saving children. So we have really 2 competing emotional forces from both sides: the disruption of families and the concerns about whether that disruption of families should be done, and the saving of children, the rescuing of them from what they've possibly could see as harm. And like you would imagine, policy has vacillated back and forth between these 2 things. On the one hand, protecting children. On the other hand, protecting families from the undue influence of the state. So looking back, I've wondered, how does policy and how does policy research really have an impact in a field that is so charged with this emotion? In the late 1980s, this was a few years after Moses, the policy pendulum swung toward a special concern about the removal of children and the growth of children coming into foster care. So family preservation services became a focus. They asked, can we provide more and better services to families before they need to be removed? Can we be engaged with the family, do something, get upstream, and prevent the placement of children into foster care? So my story starts as this focus on family preservation began, which was driven in part because the number of entries into foster care in the U.S. was climbing upward from 1988 into the early 1990s. So advocates for keeping children together rightly said, what can we do? What kind of intervention can we have that can stop this flow of children into foster care? This focus of family preservation was in the air as I entered federal service and later, a couple of years later, met David. So in 1993, I entered service with the Office of the Assistant Secretary for Planning and Evaluation. Mike Lopez is nodding his head and also remembering meetings in that same room that David was. You two were probably not in the same meetings, but same room. So I joined ASPE, the Assistant Secretary for Planning and Evaluation at the U.S. Department of Health and Human Services. And as you look, you think, who wouldn't want to work in that building? It's like an architectural marvel for sure. And that conference room, which you had to walk about 10 minutes to get to, was so far from daylight that there was no risk of any interference from anything happening outside. So I started at ASPE, and at the same time, a little bit before I started, Congress had passed and the President had signed the Family Preservation and Support Services Program Act of 1993. And this bill was, in part, very much focused on helping to stem the tide of children entering foster care. It doubled support for family preservation services, adding to the block grants to the states, and it also required a rigorous evaluation. So the task of designing that evaluation fell to me and to my colleagues at HHS, and Mike was one of those colleagues working at ACF at the time. So we looked at a range of the most popular family preservation models, and especially the most popular one, which was called Home Builders, and we designed an evaluation, as feds do, and we put it out as an RFP, and we got some bids, and we awarded it to a good contractor, and we sent them out to evaluate these services and tell us whether they worked. And all the best science was used. It was great work. It was a random assignment evaluation in 4 sites, and it was focused on determining precisely the impacts of these programs. But I don't think that we recognized that we were social scientists wading into emotional territory without full awareness of the terrain that awaited us. So the evaluation was scientific, careful, lengthy, took many, many, many years, was not completed until after I left the department. I'm not sure if Mike was still there then. And we had really fancy covers, didn't we, back then? So what did it find? Well, like so many rigorous evaluations of social programs, it suggested that not much worked. None of the 4 programs in 4 separate states actually lowered the entry of children into foster care. Placement rates were actually a little bit higher in the experimental group, though not statistically significantly so. So the advocates for family preservation were disappointed. Those who would maybe claim to be more on the child rescue side suggested this is what's the problem with family preservation. We don't know how to do it. But frankly, my concern isn't that. It's that really not many people paid much attention. And what did I expect? So I had come into government, I had studied for years and years. I'd worked hard to set up this evaluation. I wanted it to have an impact. What did I think would happen when a rigorous evaluation showed that a program did not have the effects that we intended? Well, first I thought maybe people will rethink their approaches. Maybe they'll take a hard look at how they were providing family preservation services, and maybe they'll rethink, redesign, retool this system. But the legislation didn't change. The guidance didn't change significantly. Second, I thought, well, maybe there'll be cuts in the funding if this program doesn't work. I don't know if this Carpenter's motto works for social policy, but what actually happened was that not much changed. The funding continued, the guidance around which models to use, what happened in the field, didn't change much. So there was careful work, but in the end, little change. Funding continued, it even grew a bit for family preservation services, and there was little debate reflecting the careful, rigorous evaluation work that many of us had put so many hours into. People used the same models with limited adjustment. So why did so little change? In hindsight, I think it's again because we failed to get close. We failed to look at the emotional conflict at the heart of child welfare and understand what was driving those who were supporting family preservation services. We were scientific, we were rigorous, but maybe we asked the wrong questions, and maybe we thought people wanted to know the impact, but in the end, I'm not sure that that's really what they wanted to know. So thinking back to Ron's chart, maybe this form of policy research was never going to be the driver at the congressional level. We could have saved ourselves a lot of trouble going to ask Ron, why did you even put that evaluation requirement into the legislation? But I was more disturbed that it didn't really change activity at the ground level, at the state level, or at the programmatic level. People really did not read this report and think, we should be doing something different here. What we're doing doesn't affect. And I think we undervalued the history and the emotional commitment to this issue. So, could a rigorous study really overtake centuries of emotional gravitational pull around a child welfare issue? I think that's a bit like expecting Bambi to defeat Godzilla. Our hopes were crushed. My former colleague Mark Courtney likes to say social service programs are conducted by true believers. And I think that's true in many of the fields that we work in. These are people who are not necessarily going to turn on a dime just because really well thought out, very careful research came to them and said, what you're doing is not having the impact that you wanted to have. I think our work has to connect with them, with the emotional pull that they feel, and with the commitment that they have to continue to serve families. So perhaps our somewhat distant scientific approach didn't provide the kind of information that was very likely to be used. The well-designed, well-implemented study was no match for the emotion. The number of children remained high coming into foster care. Over the next few years, it began to drop a few years after the report came out, but I don't think that there is any solid evidence that that was because of improved family preservation services. So my story ends without an impact, without the impact that we all had wished for. But I'm excited because we're getting a policy research mulligan. Who knows what a mulligan is? I don't think golf is a big APPAM thing. Oh, not bad, not bad. More golfers or people who understand golf. I've only played golf once in my life, but I love the concept of the mulligan. It's a do-over, it's a chance to forget a mistake that you made and take another whack, and we're getting an opportunity to do that. Why are we getting that? Sadly, it's because the number of children entering foster care is going back up. Not at an alarming rate, but at enough to get policy attention. Last year's Family First Preservation Services Act opened up the potential of massive new funding for family preservation type services. And this act is both, in a way, a dream for family preservation supporters as well as for our research community. On the program side, it provides for the first time the use of federal entitlement dollars to be moved from foster care over to family preservation services. This has never before been allowed, and this type of funding has the potential to dwarf the funding that has been going into family preservation type services in the past. On the research side, it requires that the new funding pay only for evidence-based programs, and it establishes a clearinghouse that will review the research on those approaches and guide the interventions. The federal government will reimburse, but only for those programs that are determined to be evidence-based. Other approaches will not be reimbursed. So that seems like a win for researchers and a win for the family preservation side, but not everybody is happy. I think they have a lot of legitimate concerns. One is that there's not enough evidence for this policy change to take place right now, or that we have the wrong evidence, particularly a concern that the evidence around what works will not translate into the child welfare environment. But I also think it's because administrators have spent years building their own family preservation programs, and they're very emotionally invested in them. Many of those efforts will not be supported by this new law because they have not gone through the type of evaluation process that would lead them to be on a list of evidence-based programs. Yet these program operators want help now. They want to be able to stem that tide of children coming into foster care. And they, again, are very committed to the types of things that they've been doing. It's going to take years, frankly, and very few programs that have been tested. With very few programs that have been tested, it's going to take years to move the interventions that people are invested in into this evidence-based category. And I share some of these concerns. Our scientific and rigorous efforts are great, but they move very slowly. I think in many ways, we are like 19th century photography. We ask programs to hold still. If they move, they get blurry. And for long periods, we take a snapshot of them to tell them what they're doing. But those who are really emotionally invested in any program, whether that's reforming healthcare, education, child welfare, are going to keep moving. They are not going to hold still, and they don't feel that they can wait. So when I think back on my experience with the previous family preservation evaluation, I wonder, how can we approach this new situation with a better chance at impact, taking more account of the emotional valence that's in the child welfare system? I think we can do better. I don't think we have to be failures. I think we can have more impact. I think we do it this time by meeting the field more of where it is and embracing its emotional aspects. We recognize the history, and we help people who are putting together the pieces on the ground figure out what's missing and how those pieces fit together. If we want policy research to have more than that 1% role, if we want to grow our impact, we have to do the groundwork. It's too important to just keep doing the same thing. And I think that thinking more about this emotional investment that people have may help us actually grow our piece of the pie. So I'd like to close with just a few recommendations. First, I think we need to, as I've said many times, embrace the emotional aspects of these programs and not hide from them and not run away from them. I think we have to recognize that policies push emotional buttons. We have to ask, well, what information would people want to know? What would they actually change? And what are they so emotionally invested in that they're very unlikely to change? And that relates, I think, to understanding more of the history of the issues. I think we could be a little self-critical that we come in to an issue without fully understanding that people have themselves dedicated decades of their lives to this program, and here come the evaluators to tell them how they're doing. So we need to understand, how long has this approach been around? How and why has it changed over time? And who's invested in it and why? I also think we need to work less to assess. I'm not against assessing, as I will get to, but more to improve programs, the ones that people are already very invested in. This probably means conducting more formative evaluation, more program improvement work, and maybe within our portfolio, a little less impact evaluation. This can still be rigorous and scientific work. It can use many of the new methods we're excited about in data analytics and rapid cycle evaluation and our improved qualitative methods. But we need to communicate earlier and more frequently. We need to engage clients, advocates, program operators, and we need to understand what motivates them to do what they're doing. This recognizes that people are invested in the outcome they're trying to achieve, and they're very unlikely to give up on that. But maybe there are the levers of what they're doing that we can help them improve and actually achieve their outcomes better. So finally, of course, I think we should continue to build evidence. We should be developing lists of evidence-based programs, and we should be doing at least some impact work. But my concern is that we should be doing that both from the top down, meaning taking the evidence from one place and letting other people know about it and asking them to implement it. We've done a lot of work over the last few years to be better at that, to help people understand the implementation of evidence-based programs. So there's still a role for that, but I'd like to see us also do more work from the bottom up. Going out and finding what people are actually doing, why they are invested in it, helping them understand better what it is that they are doing, and how to push that up the evidence ladder to become evidence-based. That requires that we get closer again. We listen more, we adapt our methods to the questions that matter the most to those on the ground, and that we're really patient. This kind of work, I've been involved in a couple of these projects, and we are many, many years into working with sites that are still probably years away from impact evaluation. But that's the kind of commitment and work and slowness that we probably have to recognize. If we want to get those programs over an evidence-based hurdle, that will not happen overnight. So we can do better at understanding, improving, and building evidence together. And I would argue that as advocates for evidence-based policy, recognizing this emotional investment will actually help us get it right and have more impact. In family preservation, it's great that we get the mulligan, that we get another chance. But I hope that my story resonates with many of you in other fields, in healthcare and education, crime and justice, and the other areas that APPAM works in. Finally, a side effect. I see an additional benefit from this type of work. I think this work will help us bring together two parts of APPAM, analysis and management. It will help us integrate those better, and it will help us move beyond the role of the 19th century photographer that I showed. That person was distant, required stasis, and was non-adaptive. I think in the 21st century, we can be more engaged improvers of public programs. It may be more in real time. It may be a little bit unsettling, but I think we can do it. We can grow the effects that we have on policy, engage, appreciate emotions, appreciate history, and help those who are truly passionate do better in what they do. I think we can not retreat from this, but we can get closer. And I think it may look a bit more like this. So how does that make you feel? It could make you happy, it could make you excited, it could be jarring, and it could be very uncomfortable. But I'm excited, and I think it could push us to some uncomfortable areas, but I think it will get us closer to what we really care about, which is impact. So with that, I will close and thank you.